Hi, Dr. Kathy, how are you? All right, today we're talking about the orgasm, okay? The orgasm and the resolution. The orgasm is the peak of your emotional, your physiological response to everything that happened to you earlier in the stages. Remember, we have the arousal and the excitement phase, and then the plateau phase, which now leads us to the orgasm and then the resolution. So that orgasm, this is the peak. Everything that's happened to you, everything that you're feeling, everything that's going on is actually building up sexual tension, body tension, and everything is moving and getting more and more, and this is crucial for you to reach that orgasm. During the plateau phase, we spoke about that yesterday, I want to point out a few things. Number one, you have to increase your sensation, your pressure, your stimulation when you're in that plateau phase. So the excitement phase has ended, you're getting into that plateau phase, you're getting close to the orgasm. This is when your partner and you have got to communicate and you increase whatever it is that you like. You have to tell your partner what it is that you like. Studies show that when you are more assertive, sexual assertiveness, you have a higher chance of getting your orgasm. When you communicate to your partner what you like, you're going to get your orgasm. When you don't, less likely. Studies also show that during this time of the plateau, as you're trying to get to the orgasm, there was a Dr. Akel, if you want the publication, let me know, I'll send it to you. And he said, or he found or discovered many years ago, a technique called the coital alignment technique, CAT. Coital alignment technique, CAT. We know it, most of us know it, and this is where you are in a position that he actually encouraged and studied, the missionary position, and you have a certain movement that goes along with the missionary position. So you're in the missionary position because you want to be able to put pressure from your partner onto your clitoris so that you can increase stimulation of that clitoris. And I know you all know this. He describes a few movements that he wants or encourages you to do during this phase, this plateau phase, while you're engaging in coitus, while you're engaging in vaginal penile sex. He encourages certain movements, and I want to mention some of those movements for you. The first one, he says, is it has got to be synchronous, slow, and I'm going to say slow, that's what he says, but for some people they want it fast, rhythmic movements, right? That will be constant, okay? So you want a synchronous, slow, again, or fast, depending on what you want at that point, rhythmic movements. And these movements can be gliding, where you're actually moving in and a little bit out and in, but you are gliding and you can actually rotate when the penis or the toy is within the vaginal canal. At the same time, trying to find pleasurable feelings within that interaction. So if you are having that penis or again the toy inside there, you're trying to locate a position. So you can lift your pelvis, you can lower your pelvis, you can rotate your pelvis. Trying to find pleasure or hit a spot. Remember those U spots? Well, the U spot's on the outside, but the O spot, the A spot, the G spot, depending on what you want, that's that gliding. So you're gliding in and out. So that's one of the movements he describes. He also describes the rocking movement. And think of a rocking chair. You're going back and forth. In this case, the penis or the toy is inside the vagina and you're staying inside there, applying pressure to the clitoris to, again, stimulate, activate, awaken, and make that clitoris have more blood flow so that it gets more aroused. That is the rocking technique. So the gliding technique is in and out. The rocking technique is more pressure stay there, very minimal movement. And then the angling. The angling also has that lifting away, moving different positions, again, trying to move in and out to different areas to find where you are more comfortable sexually, all right? So the gliding is back and forth looking for that. The angling is more lifting up and rotating, while the rocking is again moving and staying there and not moving in and out. Those are the three common ways of actually having some sexual movement that will enhance your chance of having that orgasm. And he actually believes, some studies show, that even if you stimulate your clitoris and you do not have body movements, the chances of having an orgasm is less. So studies show that you need to engage in the movement. So for those that do not move, right, we need to start moving so that you will be able to have a higher chance of having that orgasm. And that movement is either rocking, where you stay on there and there's pressure, gliding, where you go in and out and in and out, staying on those areas that you like, again, combining rotation, combining different angles to try and get to the different erogenous zones within the vagina, and also hit the clitoris. So you want to do that with all these different positions. Or you also want to do the angling, which is the same thing, but you're trying to get different positions even more than in the rocking, in the gliding position. So you're really trying to be more consistent when it comes to the rocking on the clitoris, but with gliding, you're more in and out, trying to locate favorite spots by communicating, and also with the angling, you're doing the same thing, lifting up and rotating. So again, these are different things you need to practice and do when you're in these phases. There's also shallowing, where they're just going in and out very briefly and staying there and coming out and not going deep. Again, that's probably hitting the V zone. And apart from angling, there are some other unique techniques like pairing, where you work together as one and you're staying together with movements together. So again, these are not as well studied as the rocking, the gliding, and the angling. Okay, so that's going to be important. A take-home factor I want you to improve on, and that is moving with your partner, which will need some communication. But again, you're doing that not too early. You're doing that in the plateau phase as you get close to the orgasm. Okay, that's a few pointers. Another pointer is the clitoris, the sensitivity of the clitoris, right? So we know if you stay on that clitoris too long and you become hypersensitive, it's going to lower the threshold of the clitoris. Now, when I say lower the threshold, I mean you're going to be more sensitive. And if you become very sensitive, you're going to say, oh no, I don't want any more. It's too much. And your body's going to shut down. So you have to be very careful when you're in that plateau phase that you don't reach a point of hypersensitivity of the clitoris. Remember, it likes touch. It likes vibration. It likes pleasure. There is some pain involved here. Again, it's a mix in this case, but it's a sensation that you have to be careful with and not overdo while you're in this phase. But when you're in this phase, you're going to know when you are fully aroused by the signs I told you about yesterday and the day before. And when you're fully aroused, and when she is super sensitive, she's going to not want you to touch it, and then you back off. But you've got to know when not to touch it by communication. And she's got to either communicate that to you verbally, or you observe and watch nonverbal cues and see how she responds. And you watch again for the other signs. Go back to the other signs so that you know she's getting right there, okay? So when you get up to this point with the orgasm, those are the 2 points I wanted you to realize, that you have to definitely move, right? And be careful with the pressure on the clitoris. Even if it's in the movement, if it's too much, she will not be able to have the orgasm because she's become too hyperstimulated, okay, in the clitoral area, okay? But all the other areas, don't forget, are also being stimulated, and you want to sort of bring her to this point where she's at the peak of emotional and physiological responses, and then there's going to be a release of all that tension, all that sexual tension, and all that body tension is going to be released at this orgasm point, right? And then it's going to get into the resolution where it comes down after she's reached that orgasm. So what is the orgasm? Like I said, it's the peak of emotional and physiological responses. And what are those responses? You've got, let me remind you of a few of the important ones. The involuntary muscle contractions, right? The rhythmic contractions. Some people say that they're not rhythmic nowadays. Studies are saying they might be actually irregular. But there are involuntary contractions that occur in the pelvic area, in the vagina, and it actually can move throughout the whole body, right? People have experienced that where the whole body starts to involuntarily contract. And that is so important as part of the orgasm. Those studies have said that some people are not even aware that they're having these involuntary muscular contractions. So some people might not have them, but most people do. So we're saying for most. Also, there is that increase in the heart rate, the breathing, the blood pressure, all right? That's how we know these responses are happening. So you guys, everyone should know the responses are going to be noticed, okay? So you're going to feel those contractions. You're going to see the heart rate by her flushing and her panting. You're going to see the breathing. You're going to see the flush, right? There's going to be that flush of blood, that rash, that blood rash, that facial flush, and sometimes you can see it on the chest, some people you can see it on their whole body, depending on their skin color, and you know you're getting there, all right? And that is part of the response that you're going to be looking for to know that you're getting there and whether you should back off or whether you should continue. She will communicate that to you. Then the neurochemicals that are released, the oxytocin, the dopamine, the endorphins, right? All those chemicals that are released are going to make you feel elated, happy, pleased, in that pleasurable feeling of you know, something's going on and you love that feeling, okay? Again, that is important when you're in that state and your partner should see that. It's like you're on a natural high. So you want to see that change in sensorium. You want to see that happiness, that pleasure, that, you know, response that should be observed, again, in most cases, during the orgasm, okay? Then that emotional response, you want to see her emotional. You want to see some of them cry, some of them just go boo-hoo, and some of them laugh. I've read some studies where some people laugh during their orgasms, and they warn their partners that they're going to laugh when they have an orgasm. And this is what you're looking for some people, but for most people there's this joy, there's this contentment, there's this smile, there's this exclamation of just great words of happiness with their partner when they're actually in this state of having all these beautiful hormones and chemicals released and having these emotions, again, emotional response. It's the peak. This is where it's like, oh my gosh, it's overwhelming, right? And then you have the altered state of consciousness. I've talked about this a lot. You can go back to my other talk. But in summary, this is where you lose self-consciousness. You don't know who you are. You forget yourself. It's like you're zoning in on this pleasure that you're experiencing. And it's like you're in the zone. You're in another realm. You feel that there's something going on that is just the most pleasurable thing that you've ever experienced. And for some people, they lose inhibitions and they start saying things and they start doing things sometimes that are just unique to them. And sometimes they will tell you, and they should tell you, like we're supposed to do when we communicate. And you're in a trance-like state. If it goes into that transcendent state where you're almost like in a trance, you lose touch with reality. You're actually losing touch with yourself in another place, and you really want to know that that is only for those that experience something extra. That's not for everyone. Not everyone goes into that transcendent state. I spoke about that before in one of my previous talks. But getting to that altered state of consciousness is where you are now adding all the different types of physiological and emotional responses together to get to that peak, and then you have that sexual tension, that body tension release, and everything starts to come down and you start going into the resolution phase, okay? The resolution phase is where you're going back to normal, where you are now pleased and happy, almost feeling sedated, right? And you now want to go to sleep for some people, but some people are able to, again, if they're multi-orgasmic, get aroused again and have another orgasm. But we're talking about those, just a simple orgasm here, the classic orgasm, where you just go into that resolution phase and you start going back to your normal state of how you were before the engagement in sex, okay? Now, that refractory phase is that period where you cannot be stimulated again. So your clitoris is now, when you're not able to be stimulated again, either hypersensitive or just hard to arouse again. And so you just want to have some space, some time to yourself. Now, some people can have a few minutes, an hour, and they can get back together, and have another orgasm. But most of the time, they're satisfied with the one. Again, unless you're multi-orgasmic, then you can have more than one, and then you're able to come back again and go through the same stages of arousal, excitement, plateau, and the orgasm again. Okay. I did want you to note that some of the orgasms last between 7.4 seconds to 2 minutes or longer. And the plateau phase, or the beginning arousal plateau, can last about 13 minutes or more. Okay? Again, that's what I average some of the studies. If you want the studies, let me know. I'll send them to you. But again, these are individuals that they did studies on. This is not for you. If it's not you, you just do your thing and just know that your orgasm can last a certain length of time, and also can the pre-orgasm, which is the plateau and arousal phase, can be faster when you're masturbating also. And that's because the sensitivity of the clitoris is really not something that we consider in terms of getting aroused. It's more of just going through the motions and having certain things that you do to yourself that will make your orgasm come to fruition. Some orgasms, they say, from masturbation are not the same as from a relationship. I do believe that is true. We can talk about that another time. But right now, just know that the length of time varies from individual to individual. Some are faster, some are longer. But the game plan is to reach that orgasm, that peak, where you're able to release that sexual tension and go to the resolution phase. Okay? So remember, not all orgasms equal to sexual satisfaction. That's because when you're having an orgasm, it is, again, a physiological response to all that tension and release of that sexual tension. But to be sexually satisfied, when they've done studies, they found that it is increased after the orgasm, after having a great orgasm, or after having any orgasm. It is increased when you're doing it with a familiar partner, when you are sexually assertive, when your cognitive affective aspects are in place, meaning you are thinking better, you're happily thinking with your partner, you're communicating, and you're having that great engagement with your partner, so you're able to sort of think together, okay? Be on the same page, right? And they also say it's improved with physical, psychological intensity. That means you've got that physical attractiveness and that psychological connection also to improve the satisfaction. So not all orgasms are going to give you sexual satisfaction. Yes, you can reach it, which is my game plan, but to be satisfied, you have to have some extra stuff involved, especially a partner. Now, I remember once someone said to me that masturbating, as far as she's concerned, is better than sex with a partner, and that's because she could reach an orgasm masturbating and not with a partner. I do not agree with her. I do think that when you're with your partner, having an orgasm is much, much, much more pleasurable. And I don't think you can become transcendent when you're with a masturbating toy or something, or your fingers, whatever. I think you really have to have somebody applying different pressures and stimulating different erogenous zones and going into this exclusive, hypersensitivity in terms of sensitivity, in terms of sensations, and going to those chemicals being released. I think it's just so many things that have to be done to you, not just a few things that you do when you do masturbate. So my suggestion, of course, is always having a great partner, hopefully your pair bonder, the person that you're with for a long time, and being in a relationship, marriage, and being in a long-term relationship where you can actually have repetitive, increased practice in terms of reaching that orgasm and making sure that you get that resolution and that happy sexual satisfaction, which I would like you to do. And next time we talk, I'm going to talk about relationships and see the effect they have on the orgasm in more detail. I should be talking to you tomorrow, so we'll see you tomorrow. Have a great night, and thanks for hanging in there with me, okay?